Welcome to the all viewers and well-wishers of the world. The purpose of my lecture is learn the knowledge from the world and return the knowledge to the world. Motto of my life is learn, earn and return. I have learned a lot, earned a lot. Now it is the time to return a lot to the world. The topic of today is Urticaria or hives. It is called nettle rash even though not caused by the nettles. Term urticaria is from Latin urtica meaning nettle, needles or stinging hair. The English word hives does not suggest the rash is caused by the nettles. Urticaria or the hive is an outbreak of the swollen, pale red bumps or plaques or wheals on the skin that appear suddenly. These are result of body's reaction to certain allergens or for unknown reason. They last for hours or one day before fading. They last for hours and fade in a day. So here one can see the hives, urticaria, and urticaria sometimes lead to the angioedema, in which there is severe irritation and pruritus. And here one can see the lesions of the hives or urticaria. These are red, itchy, raised area of the skin which are called hives. Rash is circular, raised welts on the skin, usually itchy, and occur in batches. Hives may cause burning or the stinging. Urticaria can appear on arms, legs, trunk, face, lips, tongue, throat, ears, or anywhere on the body. Hives vary in size from a pencil eraser to a dinner plate, means few millimeter to several millimeter in diameter. They may join together to form larger areas known as the plaques. Urticaria on the hands looks different as the skin is tightly bound, not loose like the other areas to form ordinary wheals. So here one can see the different urticaria on the different parts of the body, on the back, on the front of the chest, on the arm. So these are the classical presentation of urticaria on the different body parts. Now, instead, tiny, very itchy pimples on the sides of the finger because the skin is very tight. So, this is called chiropomphylix. Chiropomphylix hives of the fingers. They do not leave any long lasting skin changes. Fewer than 5% of the cases last for more than 6 weeks. The condition frequently recurs. Hives have been described since time of the Hippocrates, so it have got very long history. So here one can see also the hives on the back, on the hand, then again on the hand, the different kind of the hives with blisters, and even the whole face is sometime involved in hives. Now, there is one term angioedema. Some people develop urticaria but with a much larger swelling called angioedema. It is similar to the hives, but the swelling occur in subcutaneous and the deeper layer of the skin like dermis instead of the surface or on the epidermis. So, deep swelling around eyes, lips, tongues, throat, genitals, hands, and feet are seen. It lasts longer than hives, but the swelling goes away in less than 24 hours. Angioedema of the throat, tongue, or lungs can block airways, causing difficult breathing, and this may be sometimes the life threatening if not treated well in time. So, here one can see the swollen lips and the classical case of angioedema. So, angioedema is the swelling in the deep layers of the skin and the other tissue. It may be accompanied by an itchy raised rash, so one can see the itchy raised rash on the forehead. Similarly, the swelling around the eyes and the swelling of the lips. The other symptoms may include abdominal pain, shortness of breath, dizziness, and fainting, if that is going to involve the throat or the larynx. So, commonly affected areas the eyes, lips, mouth, tongue, and genitals, and the hands and the feet in angioedema. Now, there is one vibratory angioedema. It is a rare form developed in response to contact with some vibration, and the symptom develops within 2 to 5 minutes after contact with a vibrating object, abate after about an hour, or disappear after an hour. These patients do not suffer from dermographism or pressure urticaria, diagnosed by holding a vibrating device like laboratory vertex machine against forearm for, for about 4 to 5 minutes. Speedy swelling of the whole forearm extending into the upper arm is also noted later. Treatment is avoidance of the vibratory stimulants, and antihistamines are also proven helpful. So here one can see the vibratory angioedema vortex to induce angioedema in a patient with swelling of the hands while driving car, and here one can see this kind of urticaria in case of vibratory angioedema. Now, the age of the urticaria occur in any age group, and chronic urticaria is more common in fourth and fifth decades of life, but the cases of short duration are more common among children, and while cases of long duration are more in the middle aged people. And about the sex, incidence rates for the acute urticaria are same for men and women. Chronic urticaria occurs more frequently in female and in women. Cases of short duration occur equally in males and females, while cases of long duration do occur more in the females. An engineer was asked, what is the technical difference between welding and wedding? He replied, not much. Both are joints in a way. In welding, there are sparks first and the bonding forever. But whereas in case of the wedding, there is bonding first and the sparks are forever, rest of the life. Now, there are different types of the urticaria, and broadly, the rash which lasts less than 6 weeks is called acute urticaria, and the rash that lasts more than 6 weeks is said to be the chronic urticaria. So, the first, acute urticaria, it is the most common, and causes are certain foods, medication, insect bites, or the infections. It becomes evident a few minutes after the person is exposed to any allergen Outbreak may last several weeks, but hives are gone in 6 weeks. Typically, hives are a reaction to the food, but in 50%, the trigger is unknown, so the reason is also not obvious. Medicines notorious are aspirin and hypertensive like ACE inhibitor medicine and some painkiller causing the acute urticaria. So here one can see the acute urticaria picture with lot of rash and other thing, and it could be the drug allergy, it could be the food allergy, other type of allergies, and that is hot, heat or cold temperature and exposure and the stress. These are few causes which are responsible for causing urticaria. Now, in acute urticaria, food notorious are nuts, chocolate, fish, tomatoes, eggs, fresh berries, and milk. Fresh foods cause hives more often than the cooked food, and certain food additives used in the food, food containing salicylates, and the preservatives are also causing the acute urticaria. Acute urticaria is one of the feature of the serious food allergy and a symptom of serious allergic reaction affecting the whole body called anaphylaxis, a life-threatening problem, and that have to be treated as early as possible. Now, the other type of the urticaria is chronic urticaria, where urticaria lasts 6 weeks or more and it lasts for years or more in 50% of the sufferers and up to 20 years or more in 20% of the people. It is hardly ever caused by true allergy. The cause is difficult to identify than causes of the acute urticaria. Sometimes the cause is thyroid disease, hepatitis, infection, or cancer. So here one can see the chronic urticaria picture and one can see the acute urticaria symptoms last for less than 6 weeks, and in case of chronic urticaria symptoms are seen daily for more than 6 weeks. And the chronic is again divided into spontaneous and inducible. Spontaneous means there is no external obvious trigger is seen, and in case of the inducible, symptoms are induced by the specific triggers like cold, heat, or pressure, etc. Now, the spontaneous is again divided into two, in which known cause is there, that is autoimmunity or the infection is there, and unknown cause, the other type, in which the chronic spontaneous urticaria is the variety, and this is all the classification of urticaria. Now, chronic urticaria can affect internal organs like lungs, muscle, and gastrointestinal tract. Symptoms include muscle soreness, dyspnea, vomiting, and diarrhea. Many people with chronic urticaria have antibodies in their blood, and why some people make these antibodies is not yet clear. Now, the difference between acute and chronic urticaria. In case of the acute, the foods, the medication, insect sting, viral infection, or the contact are the notorious for causing the acute urticaria. But in case of the chronic, the causes are idiopathic, autoimmune, physical, urticarial vasculitis, thyroid autoimmunity, connective tissue disease, mastocytosis, infection, and the hormonal causes. Now, what are the symptoms of the urticaria? There is sudden onset and it affects any part of the entire body. There are raised red white patches, welts that resemble mosquito bite on the skin. Welts change quickly in size, shape, and location. Welts commonly last about 24 hours, and there is burning, intense itching, and stinging feeling. Rubbing and scratching usually aggravate the condition, and the common symptoms of the urticaria, and these are the urticaria and thyroid disease. This is similarly having the same type of hives. So there is patchy area of the swelling or welts wheals on the chest, back, neck, face, or buttocks, as one can see here. The occasional welts on the arms or the legs also seen, and skin lesions may itch, sting, and look pink. Now, symptoms: eruptions are small as pinhead or large as a rupee coin. Eruptions may fade in a few minutes or an hour but may appear. The disorder lasts from a day or two to a week. Other symptoms are fever, digestive disturbance, stress, and prostration. Recovery is rapid and complete, though recurring attacks may take place at the varying interval. Now, coming to the causes of the urticaria, in 50 to 80% cases, the cause are unknown, and there are four grapes which are notorious for causing the urticaria. These are ingestants taken as food, inhalant, anything gone into the breathing tract, contactant, any clothing in contact with your body, and infectant, any insect bite causing the infection to you. People with urticaria has an allergy. If we consider true, if urticaria comes after a food or medicine which causes allergic reaction, then we will say that it is an allergy. But it is not true for urticaria which lasts for months. The causes which are said to be notorious and implicating the urticaria are infections like pharyngitis, GI infection, genitourinary infection, respiratory infection, fungal infection, malaria, amoebiasis, scabies, and HIV diseases. Now, the foods as a cause are alcohol, strawberry, tomatoes, cucumber, mushrooms, oatmeal, and wheat, nuts, fish, eggs, chocolate, cheese, butter, and sausages are also among the causes. Insect bites of the bugs, wasps, bees, mosquito, flies, and caterpillars. Pregnancy that is having a kind of hive or urticaria which is called pruritic urticarial papules, and the plagues of the pregnancy which is abbreviated as PUPPP. Digestive disorders like mechanical irritation in digestive tract or the toxemia are also among the causes of in food. Chronic medical illness such as hyperthyroidism, amyloidosis, polycythemia vera, and malignant neoplasms are also said to be the causes. Now, there is a condition called recurrent urticaria. It is seen in the following condition. the sun exposure, so solar urticaria, occurring only on sun exposed skin which is exposed to the sun. Then exercise, which is producing cholinergic urticaria. Then emotional or physical stress, and water, which is causing aquagenic urticaria. Now, there are certain risk factors or the triggers that cause urticaria or the hives. These are medicine such as antibiotic, codeine, penicillin, sulfa drugs, anticonvulsant drugs, phenobarbital, and aspirin. Foods which are notorious and trigger causing the hives are shellfish, nuts, tomatoes, plants, chocolates, food additives, and berries. I have already mentioned these in my previous slides. Pollen, hay fever, cat dander, asthma, then insect bites like bees, ants, and wasp stings, bacterial, viral, and fungal infections, psychological stress, cold temperature, vibration may also be a trigger. Now, what is the pathophysiology of urticaria? Urticarial skin lesions are caused by an inflammatory reaction in the skin. There, this, there is leakage of the capillaries in the dermis, increasing the interstitial fluid coming out and causing the edema. There is binding of the allergen bound IgE antibodies to the high affinity mast cell, which do have certain receptor for these antibodies. This causes release of the histamine and the other mediators of the inflammation like cytokines like bradykinin and kallikrein from the mast cells in the skin and tissues in response to the allergic or non-allergic reaction. There is release of the cytokines from the mast cell. Basophils and other inflammatory cells also release histamine and other mediators because that is granulated WBC. Now, here one can see if there is any allergen that comes in contact the person, there is formation of antibody which is IgG. These bind to the mast cell which have got the receptor for these IgE antibodies. And when these antibodies do combine and the merge with the mast cell is having lot of granules, and these granules are released containing the histamine and other histamine like compounds which are called the chemical mediators. And among these chemical mediators which do act on the skin, these are going to produce the urticarial rash. So here one can see the mechanism behind the urticarial rash. Now, there is stimulation of mast cell by two types of the system. One is non-immunological, in which there is, one can see CSA complement, then opiates, drugs, and then neuropeptides and the cytokines which are going to cause the merger with the mast cell and releasing of the mediator. Now, there are immunological factors as one can see the receptors on the mast cell which are going to get attacked, and there is union of this allergen with these receptors which are there and here that is going to release the granules of mast cell. And also anti-IgE antibodies, these are just going to have the reaction with the receptor. Similarly, anti-FCC RI that also act on the mast cell and the ultimate result is the release of granules from the mast cell containing many mediators. Now, urticaria have got four major mechanisms. Number one, mostly acute immunoglobulin E, IgE, mediated hypersensitivity with histamine and other vasoactive peptides released from the mast cells and the basophils. I have shown you that these antibodies do combine with the receptor of the mast cell and ultimately there is release of the vasoactive peptide. Number two is result of the complement causing direct cell degranulation, mismatched blood I have shown in the previous slide. That is non-immunological urticaria when an exogenous substance causes mast cell degranulation. It is either by the direct stimulation of the mast cell or unknown mechanism like reaction to the intravenous contrast dye. So here one can see the complement is going to attack the mast cell and causing the release of vasoactive substance. Now, here one can see again there are certain triggers which are allergen, physical infection that do attack the skin mast cell which are having these receptors and these are going to release the IgE antibodies. These IgE antibodies do combine with the receptors on the mast cells and ultimately when it is going to affect the mast cell that is going to release the certain mediators which are histamine, cytokinins, leukotrienes and chemokines. These ultimately affect on the blood vessels and the basophils also release the certain chemicals and basophil do have the receptor for the IgE antibodies that do attack and also the eosinophil. These are going to release the different vasoactive substance and ultimately these are going to affect on the skin and one can see the skin color that is pink, that is basically the skin color because of the urticaria. Now, pathophysiology continuing, aspirin and other non-steroidal anti-inflammatory drugs cause urticaria by a non-mast cell mechanism. Especially in the asthmatics, the exact mechanism is unclear. The COX-2 inhibitor, non-steroidal anti-inflammatory drugs, do not appear to cause this problem. Finally, number 4, some urticarial reactions are idiopathic with no known mechanism.